Okay, number, can you hear me now? Hello? Number, can you hear me now? Okay, great. All right. Wonderful. Thank you. Thank you. Sorry about that. Thank you so much for joining. We're going to go ahead and get started. I was about to convert to my phone number, so thank you. I appreciate you letting me know that it wasn't transmitting okay. So I'm glad you guys can hear me now. So again, my name is Dr. Madeline. I'm your board certified OBGYN, published author, and international speaker. And I'm joining you today for one of our Sunday chats. And thank you so much for being here. So we'll go ahead and get started. I was out a little bit early. I don't know how many of you have been out, but I was out just trying to enjoy a little bit of the sunlight. And you know, vitamin D is one of those things that when we go to see our provider, and I have my provider as well, is one of those things that our docs will sometimes recommend that we get to make sure we have a balance of different vitamins and everything in our system. And vitamin D, it turns out, it's low in a large portion of the population. And it's very low in me. When I had my vitamin D checked last year when I went for my visit, it was very low, and my doctor recommended vitamin D supplementation. And so I try to take those vitamins as well as get some sunlight when I can. And it's actually a good thing because, you know, some of the studies have shown that vitamin D is one of the vitamins that can help boost our immune system, and we all need our immune systems boosted right now because it helps against COVID. It helps protect us against COVID. So one of the things I thought I would do today is just chat a little bit about things like vitamin D, those things that are important to check for when we go to see our provider. And I'm going to be speaking from a gynecologist perspective, but a lot of gynecologists do primary care as well. Just because some of our ladies, when they come to see us, it's easier for them if they can streamline and get as much done as possible while they're seeing us to get that annual GYN check done. And I know we're always happy to do whatever we can do whenever a patient is in front of us. There's nothing that can beat having a patient in front of you in terms of how much you're able to talk about, how much you can get done. And so, you know, if you have a gynecologist who's that type of provider, when you're in there, try to get as much covered as you can. Depending on what's going on with your situation, if your blood pressure is really elevated, if you have diabetes that needs to be better controlled, then that's usually when a gynecologist will say, okay, well, let's get you in with your primary care provider or your internal medicine doctor to see what else is going on. So what are some things to think about when you're going in for a routine visit? And we'll just chat about these things very quickly. Many of these things are things that you probably are aware of, but they became really important a few years ago, back in 2010, when we got the Affordable Care Act, because more and more of these things were covered as part of a routine preventive health care visit. And so, you know, whether you call it Obamacare or the Affordable Care Act, it used to be the case before that certain preventive health screenings you had to pay for additionally out of pocket. With the Affordable Care Act, however, many of those screenings became part of what is covered with your regular insurance. And so, for example, if you go in and you're having just a regular annual GYN exam, which when you go to see your GYN, especially if you're 35 to 40 and older, it should include a full exam. With most of us, it includes a full exam. That means listening to your heart, your lungs, doing a breast exam, and doing a pap smear if it's needed. Now, guidance has changed, and we don't need to have a pap smear done every year, but a lot of times we'll do, depending on what's going on, a pelvic exam, which means doing an evaluation of the vaginal area, the pelvic area, even though we're not taking a sample for a pap smear. And that's important to know as well, because when we're doing that pelvic exam, We will often collect swabs for different things. If you're sexually active, every sexually active person who goes in for their annual exam will usually get a swab to check for certain sexually transmitted diseases, bacterial diseases. There are many exceptions to that. If you are someone who is mutually monogamous, and that means that not only are you having sex with just one person, but that means that your partner is only having sex with you. And there are some patients who I see, and they are in a mutually monogamous relationship, and they will sometimes decline different swabs being done. You know, it's up to everyone. I think it's always better to know versus not know, but everyone has to make an individual decision. And so that's important to know about things to consider when you're going for that well women's visit with your GYN. So again, many of these things are covered under insurance plans these days, especially if you have an insurance plan that's tied to the Affordable Care Act. And the thought is that there shouldn't be a cost barrier for having certain health screenings done. So, for example, you know, if having a Pap test, which is a screen for cervical cancer, and if having a breast exam and a referral for a mammogram, if those things will save our lives potentially, or detect something early so that treatment can be implemented, then it's a good public health measure for insurance companies to pay for those things. And so that's kind of the mindset behind why the Affordable Care Act thought that was something really important to cover. So let's break it down by age group. So, you know, what happens if you're a younger woman, if you're age 13 up to age 20? I'll stop it at 20. It's recommended, ACOG actually recommends, the American College of Obstetricians and Gynecologists recommends that you go in for your first kind of women's wellness exam sometime around age 14 or 15. And the idea is that the young woman who's 13 to 20 may not need a pelvic exam, but it's more so to help begin that conversation. One of the really important things to do when you're a woman of any age is to identify a provider with whom you feel comfortable, someone with whom you can share different questions, ask questions, and share concerns, and really just someone who you can say, okay, well, I may not be sexually active right now, or I may not have certain questions now, but let me establish a relationship so that when I do have questions, or when something does come up, I know that I can go and talk to Dr. So-and-so or whoever the provider is and get questions answered. So that younger age group, up to age 20, now it used to be back in the day, and I know it was when I was coming up, you used to have to have your first Pap smear by age 18. That's no longer the case, and I want to make sure I say that because I still have some moms, you know, old school, and we've all been there. My mom took me to the gynecologist as well when I was about 15 or 16 years old. But the guidance has changed, so it's no longer required for young women to have their first Pap smear by age 18. The first Pap smear is now recommended to happen by age 21. Okay, so that's a big change from before, and that recommendation for that first Pap smear is not based on whether or not the person is sexually active. Now, if they're sexually active and they have anything going on, if they have a vaginal discharge, if they have a question about birth control or something like that, then absolutely they can have a pelvic exam done if it's felt to be necessary. But again, a Pap smear, which is a screen for cervical cancer, is not needed until age 21. And I actually think that's a good thing. You know, back in the day when we were doing more Pap smears, the thought was that we were over-screening. We were being too aggressive. And sometimes when you have a Pap smear and you have a result that comes back and it's not normal, that leads to us doing other things that we learned over time after research we don't necessarily need to do with younger women, because some of these things like human papillomavirus may clear from their body on their own, and especially now that we have a human papillomavirus vaccine or HPV vaccine, that's definitely felt to be the case. So again, that younger age group, age 13 to 20, definitely get in to see the GYN or maybe an adolescent gynecologist who can be a pediatrician. Those are pediatricians who get additional training to do adolescent gynecology. Get in to see one of them so that you can begin the process of feeling comfortable with having these annual well women's visits. Okay? So what happens when you turn 21? So the guidance, like I just said, the guidance has changed. By age 21, it's recommended that women have their first Pap test. And again, that Pap test is part of a full exam. And so that exam, like with the younger age group, will include listening to the heart and lungs. If a young woman has any questions or concerns, if she does a self-breast exam or not, then a breast exam could be part of that evaluation as well. At 21, she's going to have her first Pap test if she hasn't had one already. And those are some of the key things to look out for. You know, a full exam includes many things, but it's important definitely to keep those things in mind, specifically for a gynecology exam. Other things that we do routinely as part of a women's checkup, we check blood pressure. It's one of the things, you know, in many communities, people might refer to hypertension or elevated blood pressure as the silent killer. And that's because many times, especially if there's a history of high blood pressure in someone's family, we can walk around and not even realize that our blood pressure is elevated. And that's one of the reasons they call it the silent killer, because it can actually have really devastating effects. If someone's blood pressure is really, really high, if they don't get the signal of like a headache or maybe some visual changes that give them a cue to kind of go into the emergency room or to call their doctor to see what's going on, that blood pressure that's not controlled can lead to a bad outcome, such as cardiac disease, such as a cerebrovascular accident or strokes. And so it's really important that the blood pressure is checked as well. If someone has a family history of diabetes, there can be conversations about what different risk factors are for diabetes, whether it's weight-based, whether it's linked to a certain family member having diabetes. Those things can certainly be talked about, and diabetes can be screened for as needed. So what about some other things that we check for as women get into their, you know, late 30s and those things? Different blood tests may be required when you go in for your women's exam. Depending on your age group, it's appropriate to check for your cholesterol level. It's appropriate to check and see if you might be anemic. One thing that we haven't covered in detail that questions have been asked about maybe for a future Sunday chat is fibroids. Sometimes women can have fibroids that as they get older might get really large, might cause really heavy bleeding. And one of the things that we do to follow up and investigate and manage those fibroids is sometimes check a blood count to see if someone is anemic. We definitely would also check an ultrasound to look and see how many fibroids there were, to count them and see what's going on, see if they grow over time or if they tend to shrink. And so again, those are some of the things that are considered when women go in for their women's exams. We do different basic tests to try to figure out if there are referrals that we need to make. So one of the screenings that we do increasingly commonly, especially in pregnant women, but also in non-pregnant women, we screen for depression, we screen for anxiety. There are a lot of things going on outside of our physical well-being that are important to really try to be aware of when we're taking care of the whole patient, right? Because that's ultimately what we're trying to do, is take care of the whole patient. I know when I see patients in my practice, it's great. We get to spend time and understand what's going on with them physically, but that whole person means that we have to sit down and take time to figure out, okay, well, what's going on, in this part of your world? What's going on over here? Are there some referrals that might be helpful to make sure that you are in a good space? And that's my hope for every woman is that we're in a good space. So what about mammogram screenings? When should those happen? So there's some controversy around this. It used to be a few years ago, everyone said across the board, everyone should be screened the first mammogram by age 40. And then there were some different studies that went on, different professional organizations, and there are several as it relates to women's health and different recommendations that are made around health screenings. And so then there became a difference of opinion, so to speak, based on the results that some people saw. The American College of OBGYN still recommends that you at least have the conversation about screening, breast cancer screening at age 40. I still offer it to all my patients at age 40. There's a different U.S. Preventive Services Task Force recommendation that allows people to wait until about age 50, depending on what's going on and what the conversation is with their provider. So again, those are important conversations to have with your gynecologist when you go in and you're talking about the different things that are going on. Does anyone who's watching right now know the recommended age to screen for colon cancer? We've talked about the Pap test to screen for cervical cancer, which we start doing at age 21. When someone turns 30 years old, we add to that an HPV screen, or sometimes earlier, depending on what the gynecologist's office is offering to the patients at that time. And then by age 40 to 50, we've talked about how there's a screening recommended for breast cancer, which is by way of mammogram. Does anyone type in the chat if you know the age by which it's recommended that we have colon cancer screening, which is usually in the form of a colonoscopy. You know, colonoscopies are one of those things that people try to put off for as long as possible because they can be slightly uncomfortable. But I got to tell you, I had one last year, and it actually wasn't that bad. You know, I think the hardest part is maybe the day before because you have to drink all this stuff, which cleans out your system. But that's important to do so that the GI doctor, when they're doing the colonoscopy the next day, the cleaner your system is, the easier it is to for them to see when they look up at the colonoscope. So, okay. Oh, hey, number. Okay, perfect. So, colonoscopy screening, the recommended age is at least by age 50. There have been some studies that say that for us, for African Americans, that we should have one done by no later than age 45. And that has to do with different studies that have come up showing that for certain age groups, we might be able to detect something a little bit earlier, and there may be a higher prevalence in different groups of people. So, so that's the recommendation when it comes to colon cancer screening. What are some other screenings that I want you guys to be aware of, so that when you are being evaluated, you can ask about them and just see if there's something, if you're interested in them, or if it's something that your provider recommends, then you might know why. So one of the other screenings that's recommended in terms of blood work would be screening for hepatitis B, screening for hepatitis C. I don't know if you guys have traveled in the last couple of years. You may have seen these signs that ask about what year someone was born. And if they were born in the baby boomer years, the recommendation is that they be screened for hepatitis C. And that's because there was a peak in transmission during those years, or acquisition during those years, and people in a certain age group may be more likely to have hepatitis C. So that's why you might see that advertisement as you're going through the airports, or sometimes the bus terminals or the train stations, asking that if someone is considered a baby boomer, that they talk with their doctor about having a screen for hepatitis C. And because that's considered one of those preventive services that we were talking about, it should be covered by your insurance plan because it's a preventive item. So what else? What about an HIV test? Now, the one of the things that all of the different professional agencies recommend is that everyone have at least one HIV screening test in their lifetime. And for CDC, the recommendation also says that if your risk factors change, then it's recommended that you get an HIV screen. Risk factors mean, you know, maybe you have a new sex partner. And sometimes when I'm talking with ladies and they're asking about getting to the point of possibly having sexual intercourse with a partner without a condom. Some people do that, and that's fine, you know, not judging. But one of the ways you decrease your risk of acquiring something is if and when you do meet a new partner, being screened together to see what is going on, if there's any positivity for anything, whether it's HIV, whether it's syphilis, or any sexually transmitted infection. It's definitely a good idea to screen together to know where you both are, especially if you're considering sexual activity, possibly without a condom. Although, and you know, I have to say this, we do recommend condoms for when you're having sex, just as a way to decrease sexually transmitted infection transmission. Okay, so so those are the main things that I wanted to talk with you about. I try to be true to my 20-minute time limit because I know that you guys have precious things to do, and I always want to be respectful of your time. and I'm just grateful that you have given me, 20 minutes of your Sunday. If you have any questions about different things, different types of preventive screenings that go on or should go on when you see your GYN or your primary care provider, please put it in the chat or send me a message through DM. I'd be more than happy to respond and get back to you guys with any answers that I can. So I really appreciate y'all joining me today. Lee Thompson, thank you so much, and also thank you for sharing. Also, Cheryl, thank you also for being here. And let me see who else. Okay. And Carol, thank you as well. I appreciate y'all being here. Feel free to send me any messages, again, or questions that you might have. So I'm going to sign off for now for this Sunday. And again, I am Dr. Madeline, your board-certified OBGYN. I am also a published author, international speaker, and my mission is to help women, especially busy women, maximize the gynecology care that they get, and also help them get access to birth control without having to have long waits in getting to different providers' offices. And so I welcome you, please, to follow me on different social media outlets, whether it's Instagram or Facebook or Twitter. You can find me as Dr. Madeline, MD. That's DrMadeLineMD. Thank you all so much, and I love y'all. I'll see you next week. Bye-bye.